According to the Uganda Bureau of Statistics, WOBOS, over 12.4% population in Uganda live with a disability, with approximately 1 million people being deaf, representing 3% of the total population. At the International Conference on Population and Development, the government of Uganda committed to protect persons living with disabilities in all forms. While laws and policies have been put in place to protect people with disabilities, there are still significant gaps in implementing these laws. This is particularly evident for persons with hearing impairments who face challenges accessing services due to communication barriers.
At one time, we carried out a research. When we looked at our participants, the youngest were about 15. 99.5% had about SRH, but they were challenged and they couldn't access.
But we were looking at levels on carrying on sexual reproductive health rights and needs in schools. But however, this was stopped or delayed due to the sexual education policy.
Although some health facilities have attempted to provide sign language interpreters, this effort is often hindered by various challenges.
Towards deaf persons per se, when you go to hospital, like Shakira was talking this morning, the medical practitioners do not serve us because they don't know sign language. They think the deaf persons, for lack of a better word, we are stupid. And that also is tailored towards the local names that they baptize people like me. You go to hospital.
But the biggest issue that we first had, that when a deaf client would come to the facility, because people would only call names or numbers that are assigned to them, so that meant that this person, because doesn't hear, will sit there and wait the whole day.
These concerns were raised by civil society organizations advocating for the rights of persons living with disabilities during the stakeholders dialogue. The dialogue held in Kampala was organized by the Uganda National Association of the Deaf.
As they are going to access these services, it is their right to choose which interpreter should I go with, and this comes with trust. And I really request our clients, the deaf people, please, health is very important. Make sure you choose the right sign language interpreter when you are going to access these services.
You need to specialize in sign language interpreters so that by the time a deaf person needs those services, they need an interpreter that is specialized in a specific area. If you're going for a conference, who do you pick?
Participants are now calling for the availability of sign language interpreters to ensure that persons living with hearing impairments have better access to the care they need.
Saying that we need to build the capacity both in service and in school SRH workers, including police officers and Ugandan Sign Language. So we need to bring on board service providers, the nurses, the doctors. We need to influence policy reforms. And this can be done through, because, we have processes of budgeting. There are the budget conferences that will be carried out.
During the dialogue, stakeholders also discussed the way forward on how to address these crucial issues. The need for effective implementation of the existing laws and policies was further emphasized.
Of course, we are advocating for the national health insurance. This one we cannot sort out without it. I've looked at the NDP4. It's one of government priorities in National Development Plan 4.
So areas of sexuality needs to be addressed, and issues to do with the advocacy into special schools, advocacy in mainstream schools.
Deborah Namamonde, UBC News.
So the thing is just